Hi, everyone. Welcome to the CalAIM Path Technical Assistance Marketplace. Hope everyone is doing well on the webinar. And we are going to go ahead and introduce your list of panelists here. From the Department of Healthcare Services, we have Michael Wazar, who's the chief over the Managed Care Program Oversight Branch. Shell Wong, she is the chief of the project coordination section, and myself, Lisa Bistrup, I am the chief of the Providing Access and Transforming Health Path unit. From our public consulting group, we have Trish Parizzelli, she's the TA Marketplace Advisor. Jenna Wall, she's the TA Marketplace Lead. Eliza Met, TA Marketplace Team Member, and Katie McGuire, who's also a TA Marketplace member. Today, what we are looking to accomplish as goals, we are looking for a refresh on the TA Marketplace overview and process, a demo on the shopping on the TA Marketplace. We'll be looking at a guide for submitting a successful TA project, and we'll spotlight some successful stories on the TA Marketplace. And then finally, we'll be looking at Q&A time available to everybody. With that, I'm going to go ahead and turn it back over to Jenna.
Thanks, Lisa, and welcome everyone to the TA recipient webinar. As a reminder, this is a webinar targeted at our approved TA recipients, but if you are interested in joining the marketplace, I think this will also be a great opportunity for you all to learn more about the marketplace. So to begin, we're going to start with a refresher. We can move to the next slide. So as a reminder, what is the TA Marketplace Initiative? So the initiative enables entities that are providing or intend to provide ECM, so enhanced care management, and or community supports under CalAIM to access technical assistance from an array of qualified vendors. Approved TA recipients are able to browse our virtual TA marketplace, which kind of serves as a one-stop shop environment where eligible entities can access TA projects and vendors available for them to receive TA services. I am from the public consulting group who acts as a third-party administrator, and we design, launch, and currently manage the TA marketplace with oversight from DHCS. Next slide, please. So the goal of the marketplace is to provide technical assistance resources that can enable various entities in California to both contract with a managed care plan or other eligible entity to provide ECM and community supports, and also strengthen organizations' capacity to provide ECM and community supports to Medi-Cal members. So all of the TA projects on the marketplace that get approved must clearly advance at least one of these goals. Next slide, please. Eligible TA recipients. So many of you who are probably joining have already been approved as TA recipients, but for those who have not yet taken the plunge to join the marketplace, just a little recap on who is eligible to shop. So TA recipients might include city or county governments, county and community-based providers, community-based organizations, correctional agencies, and other justice-involved stakeholders, tribal designees and Indian health programs, and then also others. We welcome, if you are not sure if you fall into one of these categories, to please reach out to the marketplace team, and we'll be happy to share with you some guidance. TA recipients also must be submitting an attestation showing one of the following. They must either be already contracted with a managed care plan to provide ECM and community supports, or they must be planning to contract with a managed care plan and demonstrate that they are engaged with that plan to provide ECM and community supports. Lastly, there is an option where we acknowledge that some folks come to the TA marketplace to become contracted as with a managed care plan. And for that, we have a pathway where you can be approved by DHCS. Next slide, please. There are three main modalities for accessing TA resources, and the second two are the ones that we mostly focus on. On-demand on-demand resources are currently available on the PATH website, and we'll share a little bit about that at the end of the webinar. But on the marketplace, there are 2 TA projects for which you can submit an application. The first is an off-the-shelf project. So these are projects that are ready to go, offerings that provide project goals, might include project deliverables, have a pretty clear time frame, and these are developed by our TA vendors and have already been approved by the marketplace and DHCS for the structure of the project. Then we have hands-on projects. So these are customized TA projects, recognizing that you may have unique needs that need to be met. And so with these projects, TA vendors and recipients can work together to develop a unique scope of work and budget that includes, defined goals, deliverables, etc. We'll go into a little bit more detail about each of those later in the webinar. Next slide, please. Each of our projects must fall under one TA domain, so it can only fall under one TA domain. The 7 domains are outlined here, and I'll also share them during our demo and some examples of the types of projects. But it has we have various domains from building data capacity to engaging and contracting with managed care, promoting health equity, and then also training workforce. Again, more detail will be shared later in the webinar. Next slide, please. And to date, we have 116 approved TA vendors and over 500 off-the-shelf projects across those 7 TA domains. Again, vendors are approved by the TA Marketplace team and DHCS during a vendor procurement period in which we review an organization's application where they demonstrate their knowledge of CalAIM and experiencing providing TA. So you'll see here that we have a plethora of TA vendors across the TA domains, as well as projects in each of the domains. So if you are looking for something specific, I think we have a TA vendor that can meet your needs. Next slide, please. All right, and now I am going to take over the screen and I am going to do a demo of navigating the TA Marketplace. So just give me a moment as I pull that up. All right, so right now you should see the TA Marketplace homepage. You can find this by navigating from the CA PATH website. This is where you're going to have the latest information about the TA Marketplace. And I do just want to go through a couple of key web pages available on the Marketplace. The first is the project types webpage. So this will give you, again, a little bit more information about those different project types that are available to TA recipients, specifically off-the-shelf and hands-on projects. And if you are looking to view a specific project type, this view button will take you to the Marketplace to see the projects that are available under each project type. The next webpage I wanted to share with you all is project domains. This webpage is particularly helpful when you are thinking about the TA services that you are looking to receive. We include not only an example definition for each of the TA domains, but we also provide example projects for each of the domains. So for example, domain 3, which is currently our most popular TA domain, is engaging CalAIM through Medi-Cal managed care, and does include a lot of projects focused on contracting with managed care plans. If you click See Example Projects, a pop-up will appear which will show you some example projects that might fall under this TA domain. That does not mean that there might not be other project examples that would fall under this TA domain, but it should give you a sense of the types of projects that we would approve in each TA domain. Okay. Moving now back to our homepage. If you scroll down further, you will see who and how can use the TA Marketplace, where we outline each of the steps to becoming an approved TA recipient and getting an approved TA project on the Marketplace. What I want to highlight here for those of you that are not currently approved TA recipients is find out if I'm eligible to shop the TA marketplace. This webpage will give you examples of the attestation forms that are available for you to complete to apply as a TA recipient on the marketplace. So for example, if you are a organization that is planning to contract with a managed care plan, you will see this attestation form available to you. And then also clicking here, you will see other acceptable forms of documentation. All right. And then lastly, I just want to showcase as well, as we scroll down here, our announcements. So these are announcements, for example, I'll share later during the webinar, but we do have a new video showing you how to apply to become a TA recipient. And then we also have our upcoming events, including today's webinar, and also reference materials that you may be able to use when navigating the marketplace. For example, today's webinar should be available as a resource in the coming weeks. Now that you are familiar with the webpage, we do want to take you to the marketplace itself. So if we navigate to any of these buttons of exploring the marketplace that appears at the top of every page, it will take you directly to the marketplace. So projects and vendors are shown at random. So you might see a different view every time that you enter or navigate to the marketplace. I do want to show an example of an off-the-shelf project and how you can see some more details about those projects. So you will see a flag of what type of view on the card you're seeing. For example, this is just a hands-on vendor that is available for those hands-on TA projects. But see here, you will see an off-the-shelf flag that indicates it is an off-the-shelf project. You will see the project title in here, and if you want to see the full view, you can just hover over the project name. You will see that this falls under the community supports domain, which is domain 2. You will see that the vendor indicates that this project typically takes about 4 months, and that is provided by the TA vendor Quantified Ventures. Here we have a preview of the full project goals, but if you click on the project, again, a pop-up will appear showing a description of this off-the-shelf project, including key deliverables that should be developed as part of this project. If you are ready to work with a particular vendor and know that you would like to work with a vendor, you can look for that vendor in the Find Vendor view. If you click on any of these, it'll apply and those folks will show up as well as their off-the-shelf projects. Additionally, I'm going to clear that out. If you would just like to see the full vendor list, you can click or toggle this button and you will see all 116 of our TA vendors available. And then if we click on a particular vendor, just selecting the one that shows up first here, you will see information about their organization, mainly their how to connect with them, so their website, email address, and any experience that they might have with particular provider types. A full view of the organization summary is shown at the top. And as you scroll down, you will see that this vendor in particular has 4 hands-on services available, and those 4 TA domains are highlighted with a check mark here. Lastly, you will see client testimonials of folks that have worked with this particular vendor, showcasing their experience with them. All right. If we go back to the marketplace, the second piece that I want to show you all today are our filters. But before we start that, I do also want to show our filter definitions and another way to explore our marketplace. So you will see at the top here, Export Marketplace. If you select that, you will see a PDF of our filters list, which contains definitions for the different filters that I will show you momentarily. And then second, you will see the Marketplace Excel. If you click this Excel, it will download, or this button, you will see an Excel download in your browser that will show you all of the TA vendors and their projects available on the Marketplace. So navigating to filters, if I click on filters here, you will see various filter categorizations that can be applied on the Marketplace. I will briefly go through them, and then we will kind of showcase different examples of how to use the filters. So the first is project type. So if you are looking specifically for an off-the-shelf project, you can toggle to select that. Or if you are looking for something that is more customized, you can toggle the hands-on. Next, you will see the different domains. If you are aware of the TA domain for which your project would fall under, you can look or click a particular domain to ensure that you are looking at TA vendors and projects that fall under that domain. Next, TA needs. We have categorized many of the common TA recipient needs and have added filters here. For example, if someone needs help with billing and coding, we have a filter that when selected, we will have TA projects and vendors showing billing and coding support. We also have filters for providing ECM and community support services. So if there are particular services that you need support with, you can select a filter here. And also recipient service types. So if you are a particular type of provider and would like a vendor that has experience working with you, you may select one of these filters. And then lastly, we have our ECM and other priority populations. So if you work with these particular populations and would like a vendor that has experience providing support there, you can use one of these filters. So for an example, I am looking for a project that would support me contracting with a managed care plan. So for that, I know that contracting is typically under domain 3. And then my TA needs are specific to contracting. So I would select that filter. Next, I am not looking for anything particular related to ECM or community support services, but I am a housing provider. So I am looking for a TA vendor that could support me as a housing provider. And then lastly, my target population are individuals transitioning from incarceration. So I want to apply that filter as well to see if there are vendors that can help me there. And you will see that the filters have been applied as shown here. And you will see, oh, I apologize, it's not showing correctly. So let me just clear out and restart by going back to the Marketplace and have those filters show. All right, so let me just quickly go through that. And I was a housing provider. And then I was looking for support with individuals transitioning from incarceration. So it should apply, and you'll see all these different vendors available. So that is just an example of how you can use the different vendors. All right. And again, if you need to navigate anywhere to exploring the Marketplace, click the Explore the Marketplace button will appear at the top of every web page on the DHCS Path website. So if you are on-sited and you are wanting to explore the TA Marketplace, it will appear for you there. All right. With that, I think I am going to hand it back to my colleague to share these slides again, where I'm just going to give a brief overview of how to reach out for help on the TA Marketplace. All right, we can go to the next slide. All right, so reaching out for help. So as I showed on the Marketplace, TA vendors' contact information is available. We strongly encourage that TA recipients, particularly if you are planning to do a hands-on project, that you reach out to the TA vendor of choice to, one, make sure that they have the capacity to provide support on that project, that you are aligned on the project goals, and can help you in really defining that scope to submit a project eligibility application. Second, if you need support in identifying a TA vendor, a specific TA off-the-shelf project, you have questions about what particular TA domain a project that you have in mind should fall under, please reach out to the TA Marketplace team. Our email address is shared in these slides and is available to you on the website. But we strongly encourage you to reach out to us with any questions that you might have, so that we can reduce the number of times that we would need to go back to you to resubmit project eligibility applications. All right, and with that, I'm actually going to pass it to my colleague Katie, who's going to go through how to submit a strong TA project, particularly those project eligibility applications. So I think we can go to the next slide. Thank you.
Hey everyone, I'm Katie McGuire. I work a lot with the review team and reviewing PEAs and SOWs. So we want to go over just a little bit of some tips and tricks and areas that will assist in submitting the PEAs. If you want to go to the next slide. So first we start off that you become a approved TA recipient and you have submitted your application, you've received approval, and then once that has been completed, you have been approved and you are eligible for the TA Marketplace, then you can go to that next step of a project eligibility application. Jenna has just gone through the overview of looking at the vendors, the marketplace, and how to start looking at a vendor that may work best, or if they offer any off-the-shelf projects. I know some questions have come up in the chat about a little bit more information about the off-the-shelf versus hands-on. So what that is the off-the-shelf is a more standardized, already approved, it has very set areas of work versus the hands-on. If you haven't seen an off-the-shelf that maybe just really just quite isn't meeting your needs, you want a little bit more in a certain area, then a hands-on is more tailored to the recipient. And so you really work with the vendor to have that project tailored with that. The vendor would be approved in that domain. So for each project that you are wanting to get support needs and TA assistance on, you would submit a separate PEA or project eligibility application for that specific project. You are able to submit more than one project at a time, but they do have to be separated into different applications. The recipient is the one who completes this application. We do strongly encourage, especially if you're looking for a hands-on tailored project, to identify a vendor that you think that you would like to work with and reach out to them and really discuss those support needs that you are intending to receive. They can also help you a little bit in guiding you with that project eligibility application, potentially the best approach of how that project should set out and what sequence it should go in. But they will not be the ones that are completing that application in your behalf. Once you receive approval, have gone through the steps, again, we will go deeper dive into that application. But once it is approved by the TAM review team and DHCS, then you would go on to the next step of developing the scope of work and budget. Scope of work we also refer to as the SOW. And that is in collaboration with the vendor, and it is initially developed by the vendor and then reviewed and approved by the recipient before it's submitted for review. If you want to go to the next slide. So some of the application tips for recipient applications, just making sure that you're creating an account. The representative must be a part of the organization. It does help, and ideally that the account, when you're setting it up, the email associated with that individual is the organization's email. And also really ensuring that the correct attestation form is used and all the information has been completed when you're uploading it. Then for the PEAs, we're going to go over, so the project goals must be clear and not too large in scope, identifying how the project will strengthen your organization's ability to provide high quality ECM and or community support service, and or how it's to help contract with MCP for these services, particularly for the hands-on PEAs. And then also identifying any other path funding sources that the organization has applied for or received to date, and indicating how the proposed project does not duplicate funding. So that's if you have other applications through the marketplace, there's a section for you to complete there to show any how they're complementary, if it's building off of another project, or how they're not duplicative or overlapping in work. And then if you've been approved for various cited rounds, then we would ask that you do identify each of those rounds and how it may be complementary, what you were funded for, and how it's not duplicative. And then for the SOW budgets, the project goals and deliverables need to be clear and aligned. For an off-the-shelf project, it is a standard project. We do check in that SOW development to make sure that what was requested in the application that was approved, it aligns with the scope of work that's being submitted. There'll be a set project start date. That is at least 2 weeks from the submission, and that allows for the full review process of the TAM team as well as for DHCS that needs to occur. There's additional information for the vendor that they need to follow if there's going to be any travel for any in-person trainings or supports. Next slide. So a couple tips, tricks, and challenges that we see with the PEAs when they're submitted and our review teams going through them. So a big part is aligning the project submission with the marketplace goals. So ensuring that they identify and clearly outline the challenge that your organization's having for the ability to contract with an MCP or provide high quality ECM community supports, and detail how the requested TA will meet that challenge. A big part also is we're not necessarily looking for the application to fully go into your organization's mission and services, but more so being specific and really geared towards that TA project that's being requested. So an example of this would be our organization seeks this TA to better support data capacity needs. The goal of the TA is to build knowledge necessary to select the systems required to effectively leverage data. Currently, our internal systems require workflow redesign necessary to identifying and implementing data management and our data exchange services. Through this TA and the recommendations from the vendor, our organization will be better prepared to provide ECM. Pending the vendor's assessment and recommendations, we'll submit a secondary PA to implement the chosen data system. Just to note, this is an example of a Domain 1 data capacity project for this example. Also flagging, it's really good to, if there are multiple phases and you know there's going to be other subsequent projects, and this is the initial phase, you can mention that in the PEA, and that just provides additional information to the reviewer that there's going to be upcoming projects, and this specific project is the initial start, and it does not include that implementation phase. Go to the next slide, please. Another challenge, the TA project doesn't include well-defined goals and objectives. So really clearly defining within the project what's the larger goal to achieve, as well as some of the tasks that will be accomplished to achieve that goal. Goals and tasks would include the intended approach, expected outcomes, barriers of the organization must overcome. An example, the intended outcome of this TA is to strengthen our organization's housing navigation services. Our goal for this TA project is to effectively be trained and equipped to implement the housing triad community support services. We will achieve our intended goal by redesigning workflows to improve transitions, identifying best practices for working with homeless population, and grow our understanding of the local homeless service systems. If you have had an idea of where your organization could benefit from TA, but haven't yet solidified your goals, really where your starting point is, it's best to identify that TA vendor with that expertise that you're interested and use that contact information to discuss with them before submitting that PEA. It will really help make your PEA more specific and concrete, and it will increase the likelihood of approval. And to caveat by approval, that's the initial approval. If there are areas that in the PEA that the review team identifies, the scope is too large, its information is pretty broad, or it's not giving a clear picture of what that project is going to entail, then you will get a rework email or request for additional information. It does not mean that you will no longer be able to submit or update that PEA in order to get it approved. It's just that initial. So I just wanted to clarify, you would have multiple attempts. If we can go to the next slide. The third one, for example, is submitting a project that has multiple phases and very long timelines. So when looking at your project that you're submitting and the work that you are intending for it, looking at if there are phases. Is the TA project dependent on the outcome of an earlier phase? And that will help best determine the size and deliverables. For example, a project with the overall goal is to implement recommendations. The TA marketplace, we recommend submitting 2 separate projects. One would be for phase 1, and that would be the assessment and development of those recommendations. And a separate project that would be submitted later would be the phase 2, and that would be for the implementation of the recommendations that occurred in that first project. Phase 1 would be completed or has given enough information to know how that phase 2 is going, what supports are going to be needed for that to better assist in defining the goals at that later date. The project does not have to be completely finished before submitting the subsequent project, but work should have been done in order to identify those areas that are needed for that second phase. An additional consideration is the overall time that's needed to complete the proposed project. So TA projects really should be able to be completed within 12 months. If the time frame to complete all areas of that project are going to exceed 12 months, it's most likely better suited to be divided into multiple TA projects and phases. Also, the initial project can indicate that the subsequent PA will be submitted at a later date. And just flagging that if you're submitting multiple projects, that is wonderful. Just make sure that the projects do have different names to it. If multiple projects are submitted with the same project name listed, it will have to go back for rework. They really need to be clear named. We can go to the next area. Thanks. So the fourth, making sure that there is a section for indicating the connection to other path initiatives, including duplication of funding for cited grants, justice involved grants, and other TA projects. So making sure that you're providing and completing that, writing an explanation how with the PEA that clearly describes why the activity supported requested in the TA cited JI grants are not duplicative of one another. For example, a response to the question, have you received funding through cited grant or intended to apply? If yes, which rounds have you received it and how will the requested TA complement, support, or expand on? And how this TA is different or non-duplicative. The requested TA will complement or expand on our round one cited by implementing the data system infrastructure that you received cited funding to acquire. It will complement expand on round two cited grant by training the staff we received cited funding to hire. So making sure if you've received multiple rounds of funding that each of those rounds of funding are identified. If it's not included, you will receive a request either for additional information via email or giving guidance that you will have to submit a new PEA with the additional information that does delay the approval because you have to resubmit. And then just so you're aware that all of the PEAs are reviewed extensively against the different funding sources to ensure that the information is fully provided, as well as there's not any foreseen duplication overlap in the areas. You can go on to the next slide. So once you have submitted your PEA and it has gone through the review team, it is approved. The review team does send a capacity check to the vendor to make sure that they are able to support the TA project being requested. And then it is sent to DHCS for their review and approval. And once they receive approval, you will receive, and the vendor, notification that the PEA has been approved and is ready for the scope of work, or SOW, to be developed in collaboration with the vendor. So it is available in the vendor console. When it's when it's developed, so the vendor will do the initial development of the SOW. It will go to you as the recipient to review and approve all the areas. If you had any questions regarding it or it needed to be sent back for any changes, you would have that option. But once you've approved all sections, then the vendor submits the SOW in their console, and that puts it in queue for the review. And then there are steps. So the TA review team will review it. Once it is reviewed, ready for approval, then it does go to DHCS for their review and final approval. If there were any areas that needed additional information, updates, or clarification, the TAM team would send back the SOW and rework. The vendor gets a notification in the console in the specific areas in question. If that happens, then they would update it in collaboration with you, and then you would complete the review and approval again, and they would submit it. And then once DHCS has reviewed and approved it, then an automatic email will be generated following that approval, and it will go to the vendor's legal signatory. They sign it, then it automatically goes to you as the recipient's signatory. Once you sign it, then we receive it, and that project's executed. You are able to start the work of the project either at the project start date that was identified in the SOW, and all signatures have been completed, fully executing the project, whichever date is later. And we can go on to the next slide. All right, and what happens next? Go to the next slide. And I think I'm going to pass this back to Jenna.
You know, I'm
Eliza.
going to pass it to Eliza. Thank you.
Oh, sorry. Sorry, Eliza. It's going to you.
Thanks, Katie. So I'm going to provide a brief overview of how to add PA recipients, recipient delegates to the console. So if you want to add a member to your recipient console account to have access to your ongoing PEAs and SOWs and budgets, this is a process you need to follow. I'm going to give a brief overview, but if you want a step-by-step run through, it is at the end of the slide deck, which will be sent out after the fact. So go ahead and log in to the vendor, into the vendor, into the recipient console, and click on the organization details icon in the left-hand pane. Then click view under the header team members and click invite member button in the top right corner. After that, you can enter in the user you want added as a delegate into the form, and the newly invited user will receive an email with a temporary password to sign in and gain access to the account. Next slide, please. All right, progress reporting. So we are actually about to enter the Q3 2024 progress reporting period. Many of you may have received an email from the marketplace team last week, flagging that this is coming up for you all. And I just want to go through some logistics and why it's important. Recipients are required to complete progress reports for all active projects they have on the marketplace. Vendors are required to do the same thing. And the way we do this is we review these quarterly. So if you have had any active projects for the prior quarter, and in this case, we're looking at July, August, and September, you're going to have to report on the progress that was made, the kind of contact you had with your vendor, what sort of progress you made towards deliverables and other goals, etc., and whether you had a positive experience. We do take these really seriously. This is how we learn whether you're having any challenges, whether it's meeting your project goals, or whether the vendor's not meeting your needs, or a whole host of factors. It's also how we learn success stories. So are vendors really meeting your needs? Are you able to significantly increase your capacity to provide ECM and community support services? It's how we learn and grow as a marketplace and how we best support you as TA recipients. So for folks who did have active projects over the past quarter, you're going to be receiving an email from us next week. It's going to have some attached guidance to it, which will lay out all the details you need to know. There'll be several opportunities to click on a jot form link. So this link takes you to the survey questions we ask each recipient. Also in that email will be a little chart that will have each project that was active during the prior quarter, as well as a product ID, the vendor you're working with, and the project title. So all we need from you is to submit a project report for each one of those listed projects. You don't need to submit any other project reports for projects that are not listed. And if you have any questions about the process or any difficulty accessing that link, please let us know. I do just want to flag that the TA Marketplace team will not approve any new scopes of work and budgets that are submitted for recipients that have outstanding progress reports. So we appreciate your cooperation and submitting those progress reports in a timely fashion. You'll have until the end of October to get those in. So more to come on that next week. Next slide, please. I also wanted to provide an overview of the roles that recipients play in SOW and budget approvals. So while the TA vendors draft invoices at regular intervals for the work completed on TA projects, you all are responsible for approving those invoices on those vendor approved projects. This is basically an attestation that the work was actually completed for you. If you have any concerns about the work performed by TA vendors, please reach out to us and let us know. We'd love to talk about this with you further. So similarly, amendment requests, vendors will submit those amendment requests to the TA Marketplace for approval after discussing any necessary changes to the TA project. Once approved, the vendor will make the changes to the SOW and budget through the TA Marketplace console. Once again, you all are responsible for approving those amendments to those projects and signing the amended scope of work and budget once approved by the TA Marketplace. Next slide, please. TA Marketplace successes. Next slide, please. So just some overview of where you all are coming from and the kind of organizations we're seeing. 557 organizations have applied to be TA recipients, and 453 of those have been approved. On average, we are reviewing recipient applications within 5 business days, followed by review and approval by DHCS within 5 business days. Next slide, please. So marketplace projects, 632 TA projects have been approved to date. On average, we're reviewing those PEAs and SOW and budgets within 5 business days, and then followed by review and approval from DHCS within 5 business days again. Next slide, please. So some success stories from our recipients. Our work with EPISA provided our organization with high-quality business materials to improve access to partnerships and contracting and improve the community of value proposition with healthcare payers and other potential cross-sector partners. The work with EPISA helped our organization clarify our goals and determine next best steps to take in the process of obtaining a contract with Medi-Cal managed care plans and pursuing other opportunities for more sustainable funding. This is the type of feedback that we would love to see as part of progress reports, but also any kind of positive experiences you all have help other recipients find a good match for them when selecting a vendor on the marketplace. So we love to see success stories like this. Next slide, please. All right, here's another one. The project has significantly impacted CHC by enhancing our understanding of how to serve ECM populations, particularly for pregnancy birth equity populations. Hansard has helped us leverage strong, established relationships within the perinatal and postnatal provider community in Fresno County as a model to expand and enhance awareness and education about our new birth equity program across our catchment area. And that's from California Health Collaborative. Next slide, please. The support provided through this project has enabled LACHC to review and improve our current ECM workflows while exploring opportunities to expand the reach of our program. The Factor team has offered guidance in presenting various staffing and financial models to maximize staff capacity and reach. This includes ECM director coaching, managing staff, and implementing new health plan workflows. Factor has critically reviewed our current staffing models, contracts, reimbursement rates, and funding sources, and is developing a strategy to ensure our program is sustainable for both staff and the organization as a whole. Another overview about Chapman. The Chapman consulting team has helped us build relationships with new MCPs that will allow us to serve more clients in both ECM and community supports. So again, real reviews from real recipients that have had really productive relationships with vendors on the marketplace and significantly improve their capacity and workflows, reimbursement workflows. So there's just a lot to be gained from reviewing these reviews and hearing from recipient testimonials. So as a reminder, hands-on projects allow TA recipients and vendors to work together to create a project that truly aligns with the recipient's unique TA needs. So just keep that in mind as you're building out those PEAs and those scopes of work, because you really can tailor them to best meet your needs. Next slide, please. This is a plug for the success story webpage submission. So if you are interested in sharing your success with the TA marketplace with us and with other folks who are interested in becoming recipients, you can submit them here. Again, it really does help folks to see what opportunities exist and the kind of support they can receive through the marketplace. So go ahead and submit your success stories here. And next slide, please. I think I'm handing it back to Jenna. Yeah.
Thank you, Eliza. All right. So before we begin our Q&A period, I did just want to highlight some resources, new and old, that are available on the marketplace. If we go to the next slide, first, want to show you again the webpage for on-demand resources. We do have on-demand resources live. For example, our TA vendor fairs that we held in the spring. We have the recordings and presentations from our vendors for each of the TA domains where they showcase their offerings. Additionally, we anticipate in November that we will have 2 new on-demand resources that were developed by 2 unique TA vendors on the marketplace that will support you with navigating CalAIM, as well as providing an overview of Medi-Cal managed care. So we do encourage you to check back often, as they will be uploaded as they become available. We will additionally, showcase these resources during our webinars, the PATH newsletter, etc. So we do encourage you to keep track and sign up for that newsletter for the latest information. If we go to the next slide. TA Marketplace resources. So many of you have asked if these slides will be made available to you all after the meeting. Yes, we will be working to get you these slides in the coming weeks, which will include all of these great links for you all as you dive deeper into the TA Marketplace. For those of you that are not currently TA recipients, we do have an application guide, which is a recording of how to determine eligibility and apply. Additionally, we have a FAQ document for our TA recipients that answer questions about eligibility, submitting a project eligibility application, scope of work and budgets, progress reporting, etc. So these were recently updated following those spring vendor fairs. We have the marketplace filters, which I demonstrated during today's presentation. Additionally, we have model project eligibility applications. I do want to plug this for our current TA recipients that are looking to submit new project eligibility applications, or those of you who are new to submitting a PEA. We released these in the spring to help you submit a successful PEA. It includes, I think, at least 3 examples of really strong project eligibility applications that were submitted to us. And we showcase why they were so strong, particularly how they showcase many of those common challenges, or address those common challenges that Katie described during today's webinar. So we do highly encourage you to review that document. And then lastly, we have our sign-in guide and account creation guide for the TA Marketplace. All of these resources, again, are available on our website. But if you do have any questions or concerns that are not answered on the website, we do encourage you to email us at tamarketplace@capath.com. We generally give responses within 48 hours, even if it's just an acknowledgement of your email, and do try to give you a response as soon as possible. And with that, I think we can go to the next slide, where we have our time for Q&A. I do know that there were quite a few questions that repeated throughout today's webinar that I do just want to highlight. The first being the timelines for approvals. So would just generally say that if you are applying as a TA recipient, it typically takes about 5 business days to get approved. For project eligibility applications, it takes about 10 business days. And then scope of work and budgets, again, another 10 business days. That is assuming that we do not need to go back to the TA recipient or vendor for any additional clarity, questions, additional detail to be included. But those are the general timeframes. Additionally, another question that I saw come up quite a bit was, can I have multiple TA projects at once? The answer to that is yes, you can, so long as they are not duplicative of each project. So making sure that, they have different project goals, deliverables, etc., and that you all have the capacity to take on multiple projects with possibly multiple vendors. You can have multiple projects with multiple different vendors, but again, please take in consideration the time that you have available. All right. Some other questions coming in. There were some questions about maximum number of projects that can be submitted. Currently, we do not have a maximum, again, just taking into consideration your time and availability. In terms of dollar amounts, we do not have a maximum there as well. We do leave it to the vendor based on their labor rates and working with you all to develop deliverables that would make sense for each unique project. But we'll need to have that reviewed by TAM and DHCS to ensure that it is, reasonable, given that this is state and federal dollars. All right. I see a couple of questions about TA vendor procurement. We do ask that these questions remain for TA recipients. TA vendor procurement, more information will be coming about that procurement opening in January, so January 1st. So if you have any specific questions, please let us know. And additionally, some questions about Cited. We do not have any answers regarding Cited and their timelines. We do encourage you to reach out to the Cited team using their email that was shared in the Q&A. A question about the difference between off-the-shelf and hands-on. Happy to answer this question. So off-the-shelf projects are projects that have defined project goals and project deliverables, and were developed by the TA vendor during one of our vendor procurements. So therefore, the TA Marketplace and DHCS have seen what the typical project goal and deliverables for that specific project. So typically, it could be approved a little bit quicker than a hands-on project, and also requires a little less back and forth between the vendor and recipient, given that that structure of the goals and deliverables being already approved and set. The off-the-shelf projects were meant to be a way in which TA recipients that are new to the marketplace could really understand what was available to them and maybe just get started with the marketplace. Hands-on projects, on the other hand, are for projects that really need a specific focus based on a unique TA or TA recipient's needs. As part of the hands-on projects, you will likely be working with the TA vendor a bit more closely in developing your project goals, project deliverables, and kind of setting your expectations with the TA vendor of choice. All right. A couple questions about the availability of the TA Marketplace. So as of right now, the TA Marketplace is available. We are working with DHCS to set a date by which we will no longer be accepting projects. I will flag that the waiver does go through 2026. So for the foreseeable future, we are accepting all TA projects and recipients to the marketplace. Looking to see if there are any additional questions about the TA. One important question that came up is confirming that TA vendor services are free of charge to the TA recipient. Yes, so long as you are a approved TA recipient and your service, the TA project is approved by TA Marketplace and DHCS from an approved vendor, then yes, these services are free to the TA recipient. Right. We did also get a couple of questions about progress reporting. So do you just want to highlight again, as Eliza stated, that that is upcoming for projects that were active from July to September of this year. Recipients will receive an email stating that they must complete it. We do want to note that TA recipients are required to answer the survey. You should not be having your TA vendor complete it on your behalf. We really are looking for your direct feedback on your TA project, your TA vendor, so that we can really support the future of the TA marketplace. And all right, I think we have 1 minute left, and I see a question about on-demand resources. So yes, on-demand resources are free to the public. Does not require an application on the marketplace. These resources are publicly available on the CA Path website. And as stated previously, resources will be added as they become available. So we encourage you to check the CA Path on-demand resource library often to see if there are any new resources that may support your organization. Right. Alrighty. And lastly, I will just end with, if you have any additional questions for the TA Marketplace team, any difficulties with logging in, questions about what domain projects fall under, how to complete your progress report, please do not hesitate to reach out to our team. If we go to the next slide, you will see our email address available to you all. We really encourage you to contact us there. And with that, thank you all for joining today's webinar, and we hope you have a good rest of your day. So thank you, everyone. All right, I am gonna ask that Courtney end the meeting, and I think we're, thanks, everyone.